So I work with Narayan Netralaya. I'm an assessor with NABH. Those are my affiliations and disclosure. No other financial disclosure there. And some important terms which we are going to use in presentation sometime, you'll find HCO, ECO, SHCO. So HCO is healthcare organization, means the hospital. SHCO is a small healthcare organization. Small here means less than 50 beds. And ECO is an eye care organization. So these reference definitions or these things will find all across our presentation. So just remember ECO is an eye care organization. So when you want to go in for NABH, you'll heard all those things, ECO. So this is an eye care standard book. This is a hospital standard book which Dr. Mohana was talking about her in, keynote address. And this is a entry-level standard book. So first and foremost, when you're going for NABH, you have to select one of these standards which is applicable to your hospital. Eye care standard is applicable to any eye hospital, irrespective of size, but it should be only eye hospital. So if you have an eye dental, this will not be applicable. Or if you have an eye gynae or eye along with some other thing, this will not be applicable. In that case, you will have to go in for either an SSCO standard, okay, or if it's a huge hospital with eye care as part, then you'll have to go to full accreditation standard. But if it's a standalone eye hospital, use this standard. This is specific to eye care and helps a lot. Now, this is an accreditation standard. This is a pre-entry standard, which we talk about insurance. We say, no, you need pre-entry accreditation. Now, this is not an accreditation. It says pre-accreditation, but it's actually a certificate. So it's called a certification standard. So you get a certificate which is valid for 2 years, whereas in accreditation, you get an accreditation certificate, right? So that's the two difference, though the name is misleading there. So once you choose the standard, you need to get a copy of that standard.
Is that for a specific period?
Which one, sir? This is 2 years. This is 3 years. We had that video, no, a cycle of 3 years. So all accreditation standard, this one, it's a 3-year cycle. Certification is only for 2 years. So 2 and 3, there is no other value to be removed. So again, we had this. All these books, if you are going to see, which I showed, will have 10 chapters. It's standard. And these are the names of those chapters. So all of them will have 10 chapters. First 5 chapters are clinical chapters, patient-centric chapters. These are all organization-centered, management chapters. You can call in this way. So this is our clinical part. This is kind of management part. Okay. So this will be same across any standard you take. So it's very easy for us as an assessor and hospital to scale across standard. So what the difference will be in AAC, if you are starting with small standard, let's say there are inside only 3 standards and 15 elements. The more you go, the number will keep on increasing. Okay. So these are just comparison. Eye care has got 305 standards and SHCO, the green book which you had here, entry level. This one, it has got only 105. So now you can get the difference, how much it would be. So that's why you have to do less. This is 149, this is 305, so it's half. So that's why it's a stepping stone, and obviously it's easier to do in case you want to start. How are you going to get these standards? You have to go to NABH website. Now most of the information has changed on NABH website. Things have changed quite a lot during COVID and last 1 or 2 years. So for current information, if you have any doubt, dilemma, check on NABH website for announcements, for changes which come there. Even we are going to assess that, or we get a mail from NABH that this change has been done. So that's the way we also keep abreast. Don't go in for any hearsay. Anything which comes on to NABH website is the thing. So if you are going to go there, here in accreditation, you will have this one page where you can download this standard free of cost. Earlier it was not. So you can download PDF of all these standards free of cost. If you want a hard copy, you'll have to order with whatever money and then they send it via courier to you. So whatever standards you want. So basically we need eye care standard. You might like to have this standard for reference because this being the Bible, if you have a doubt, we refer to this. So this is our reference book, you can say. So our subject book is eye care standard. Reference book will be this in case you want to refer to something beyond. Or you also have an eye care guidebook to refer to. So when you are going to NABH website, this will be the page and you are going to go to the accreditation and then you will get this eye care program. If you are going to go into eye care program, these are the things which you are going to get. It gives you quite a significant information what you need to do, which if I try to cover will take quite some time. So go through this, all these things. And your next question would be, what is the current fees? The fees is mentioned here. It is mentioned here. It's the bottom part of this. You scroll down, you get also the fees which is applicable. And here you have to see, there is no concept of bed. That's the difference in eye care standard. We don't count beds because you may have a 2-bed organization, something. So in spite of bed, instead of bed, we count the major surgeries, not the minor surgeries. So number of surgeries, what you're doing, based on that is your size of hospital and accordingly you pay the fees, right? So that's the difference again, that ECO will be cheaper for a smaller hospital.
So cataract is better than minor?
Major, yeah. What else is there? Minor, I mean to say something which you are doing minor OT, chale on by CK. You count your cataracts, you count your refractive surgeries, you count your retina surgeries and make the yeah. ठीक है अभी रिवीजन है ना मैडम ने बोला उस टाइम कन्विंस करा दो माइनर okay. चलो good, at least someone is listening. अच्छा, then you go there in resources section. Okay, all the new announcements are going to come here. They've changed the website recently. If you have accessed it earlier, go again. And in resources here, these two guidelines are very important. Guidelines for air conditioning. This is a Bible now. You follow this. And see, in case you are not complying to that, please check what leeway can be done or something. But beyond this is not what NABH is looking for. Okay. So one very clear thing in this guideline, when you read, it says no modular OT required. You want to have modular OT, your choice. But there is nothing like that, that for NABH you need to have a modular OT. Which again brings me an example, a practice in Rajasthan, flourishing practice, minting money, not an issue. They decide to go in for NABH. We want to be better in the city. And someone gives them a suggestion some 5-6 years back that you need to have a modular OT now. And it will take some 30 days or something. They closed their practice, OT was closed, modular OT took some 3 months, they can't operate, and they spent huge money. Modular OT also they bought at double the price according to me. And in the end, 3 months of OT closure, double the price, and they are going in for an entry-level stand. It was not required. So wherever in your hospital now, you get an advice or you read somewhere that a major reconstruction, major expenses involved, double check. See, you buy a mobile phone, you ask 10 people, yeah, which model is good? You buy a car, you ask 10 people, yours is going okay. So that time, for 20-30,000, we have our due diligence. Here, people suddenly spend lakhs and lakhs of it without even having a second thought. सर आप इसको डाउनलोड करके पढ़ लीजिए तो ये है इसमें कुछ भी डाउट है all of us are available and all our talks are already last AIOs are on there. You can get our details if you want. Please mail us, please talk to us. Whatever we can clarify, we will.
Just one question, sir. So do we need HEPA filter or AHU unit complete?
HEPA filters can't be installed without AHU. Air handling unit will have HEPA filter on the inside. I'll come to the OT designing. We have a talk on that. Okay. Then these all NABH brochures, and here you will get all the training programs also. This site is informative. You want to become an assessor, they have called for application now for becoming an assessor till 11th of June. So that is a new announcement there. Okay, now this is the most important subject. Talk to your friends. Okay, and the most important caveat is talk to your friends outside ophthalmology. Because ophthalmology audit is cut and paste for me now. Every hospital is making the same mistake. Or let's say not a mistake, is missing the same thing. So 5 eye hospitals will have the same 5 set that this was not there, this was not there. So I can just cut, copy, paste and give a report. Why that is happening is because in ophthalmology, some 80s and 90s, somewhere the mistake has happened in our big institutes and that has been replicated everywhere. So I have seen something wrong, I have copied something wrong. I have seen something wrong again, someone copies again from us. So visit other specialties which are similar, like go to an ENT hospital, go to a general surgery hospital, which are going for a similar standard, like an entry level, and you'll get your answers. Asking answers amongst ophthalmologists is more of a time waste. You please go out and see. And next step is visit the hospitals. So, go to any NABH accredited hospital, this is ours, and see for yourself how that is appearing different from your hospital, how the things are being done different. You will get a broad mind how you are going to implement in your hospital. Because we have been working in healthcare, half a day, you will actually see what changes you want to make. And then you can make a list of it and, document and do that. So, people have done it, we can always learn from them. Especially now when so many hospitals are accredited. Initially it was difficult, the pioneers had a tough time because you only had to seek answers and ask NABH and ask other people. But now every city there is a hospital which is accredited. And if you are practicing, we'll do have friends. And again, there is a regional flavor to NABH as far as certain documents and certain things will concern. So that you go by your region. Your state will have some regulations. So what I am doing in Bangalore may not be applicable to you, the state regulation part. So be aware of those changes. And one very interesting anecdote here, 2 of my juniors, one my MBBS junior and one person who did fellowship in our hospital, finished, they had their practice. Their practice is about 1 kilometer apart. Both of them went in for NABH assessment and that was also on same date coincidentally. Okay. Accreditation done, they got their report. 1 week later, both of them are sitting together in evening over a drink and then they're discussing NABH. They had a disagreement and they called me. Okay, sir, both of us have this thing and our hospital are same, this is same, they have got NC, I have not got NC, this is, I said, what happened here, sir? Finally, I found out one of them had applied in eye care standards, the other person had applied in entry-level standards, and hence the report was different. Okay, and the guy who had applied in eye care actually wanted entry-level. Both of them wanted entry-level.
You need to apply for entry level first.
Sir, no, you can apply for eye care. Aapka choice hai. You decide what you want. So that's why I'm saying, first decide what you want. See, now this guy has done everything and realizes that I wanted entry level, but I have applied for eye care. Why? Because some consultant said something or made mistake or whatever it was. Okay. Now, where will you get more information after you have these guidebooks and all? Attend training programs. We have done 45. We have been doing it. We're starting again. If your state society or district society wants us to conduct a training program, please invite us. We'll come. NABH does training program. Information comes onto NABH website. You get a certificate also for that. 1-day program, 2-day program, 3-day program. Program on implementation, POI they call, is a flagship program for NABH for any standards. And then there is something called CAHO. You can Google CAHO. CAHO does these training programs extensively all over. They also give you certificate. So AIOS and state society, these are the areas where I feel you get specific. The AIOS and our programs are totally geared towards eye care. We don't talk about anything else. Other programs are generic in nature. So if you're multi-specialty, those programs will be better. You can send your staff, and once the programs are happening in every nook and corner, the traveling is not an issue. Earlier, they were restricted to metros alone. In fact, in Maharashtra, we have had a program in Nashik, Pune, Mumbai, and Nagpur. 4 we have done pre-COVID. Aurangabad was due, I think, so that's the time when COVID started. Okay, so we lost somewhere. Okay, and this one book you can download. This is an AIOS CME series. Madam is an author, I have authored, Dr. Nimal. So whatever we know, we have actually compiled in this book. So our knowledge is there. You can download this from AIOS website and see if this helps you. And very important thing, it has got a good list of KPIs to be done, which is for ophthalmology, which will not get anywhere else. So then you can go into the entry-level certification. Here again from this certification section here, and here you will get one guidebook. You get assessor guide also, which we read and come. You will also get HIC manual, which you can also adapt for ECO. You will get sample SOPs also, which NABH has put. And there is accreditation. So these arrows, these 3-4 things you take from entry level, and you can get started. So you'll get the flavor of things, how they should be. Hand hygiene is one component. For hand hygiene, don't break your head. All of us follow WHO hand hygiene page. Go there, there is videos, how to do, everything is there. You can copy, it's a standard all across the world. Then WHO Safe Surgery Checklist, take this. It has been adapted and published in various state journals, various national journals. You can adapt also for eye surgeries, change it, nothing to be done. Use a standard format, no need to make your own checklist. Some things you want, add to this one. Important thing, high-risk drug list. ISMP high-risk drug list is a standard which we use. You can again see which of them you are using in your organization, and that becomes your high-risk drug list. Right, no need to copy paste. You copy from other hospital, half the drugs which we have are not there, half the drugs which they are using, we don't use. Then LASA medication. LASA is look-alike, sound-alike. Again, you can take ISMP list of confused drugs, and if you want to use this tall matter thing, this is again there, where we write them in a mix of small and big letters to avoid confusion. So these lists are also standard. Take this list as a base, and then you can add upon whatever extra you take. Okay. Then more information. If you want to go a step beyond and you really are serious beyond this insurance and other things, that really I want my hospital to stand out. One of the best way to start is look at all these other organizations. They put lots of information, and whatever we feel is going to help us, we adapt happily in our organization. So their pages will get so many things, checklist, tools, some case reports will be there, and then you can see how we can get that into our practice. So that will be a brief